Hi, Barbara. It's Kelly. I'm sorry that we couldn't get together in person to discuss a few things, but I just kind of wanted to recap a couple things that we discussed in our care plan. And I know that Dr. Eli and Dr. Manning have discussed with you also. Um, at this point, you're doing pretty well with your rheumatoid arthritis. You're experiencing the occasional flare ups. And I know you're doing your best to try and prevent your inflammation and also to increase your mobility, or I should say, maybe at this point, to sustain your mobility of your joints. And that's a wonderful thing. Fortunately for you, you've been able to maintain everything with over the counter NSAID use, and that's terrific. And you're also doing those paraffin dips for your hands, which I personally love. A lot of people like heat on their affected joints. Some people also find benefits in cold therapy, so that's something you might want to consider also. So anyway, the purpose of this brief video is just kind of talk about where you are, where you're headed, and things to consider for the future. So what I wanted to discuss were a few of the conventional medications which you're already using as far as your over-the-counter NSAID use. But I know that moving forward, Dr. Eli and Manning also talked to you about methotrexate and the possibility of adding some prednisolone in. So we'll touch briefly on that. What I really wanted to get into, the meat of this, is to discuss your bone density, your diet, and your nutrition, some non-conventional therapies, and also the importance of exercise, which I know that you're aware of. So one of the medications that we're looking at moving forward is methotrexate. This was originally made up actually as a chemotherapy drug for cancer, but it's found to have many other benefits to it as well. It's used in a low dose for rheumatoid arthritis and other rheumatic diseases. Methotrexate works as well to reduce inflammation, and it's also kind of a preventative for joint damage. So that's going to be important to you also. There are a couple risks involved. People using, and I'm reading this, people using methotrexate are strongly discouraged from drinking alcoholic beverages. I know that you and Cliff have a pretty active social life. I know that you like to imbibe in wine every once in a while. So this is going to be important for you, not only from a medicine standpoint, but also from the RA, rheumatoid arthritis standpoint. What they suggest is less than 2 alcoholic beverages per week for your particular situation. You're going to want to stay in really close touch with Dr. Eli and Manning if you start methotrexate. You also need to consider, if you start that medication, that you do not want to risk a pregnancy. So depending upon what your and Cliff's plans are, that's something that you need to consider. Now, I wanted to read this briefly. Testing performed prior to methotrexate, which Dr. Eli or Manning will talk to you about, is a chest x-ray before beginning your treatment and regular blood testing. Also, when taking methotrexate, you are supposed to take 1 milligram daily of folic acid, and this is to reduce the risk of some certain side effects, which are mainly upset stomach. So that's something to consider if you start the methotrexate treatment. Another one that I wanted to touch on is a corticosteroid, prednisone. A lot of people have heard of prednisone. It is a very strong anti-inflammatory medication. It could be prednisone, it could be prednisolone. They can be taken by mouth. They can also be injected into a vein or directly into a joint. So you've got 3 modalities there, and you'll want to discuss them again with Dr. Eli and Dr. Manning. Now, glucocorticoids, as they're called, work very quickly. So quite a few people use them for the flare-ups. They work quickly. They're out of the body fairly quickly also. There are some individuals that use these for long-term use, but I don't believe that we're there yet. And again, that's something Dr. Eli and Manning will talk to you about. What I really wanted to discuss now and get into the meat of it, just between kind of you and I and, Dr. Eli and Dr. Manning, is to concern yourself with bone density. Women hear about this all the time, especially postmenopausal. But in your case, you also want to consider premenopausal, you just want to consider this as part of your disease process, and the fact that it does affect your joints, it does affect your bones, it affects other tissues as well. But we think of arthritis as working on our joints, our hands, our feet, our knees, our shoulders, our elbows, all of that sort of thing. So this is something that you want to consider. Now, to prevent osteoporosis, avoid smoking. I know that you don't smoke, but also consider secondhand smoke as well. So avoid that at all times. Osteoprevention is mainly diet as well as exercise, but right now we'll just quickly touch on the diet aspect of it. What they recommend is an optimal amount of calcium and vitamin D in your diet. Fortunately for you, I know you're a milk drinker. I know you like your yogurt, that sort of thing. You get a lot of calcium, and you actually get a lot of vitamin D from that as well. What they do recommend for you is approximately 1,000 milligrams of calcium per day. And for your vitamin D intake, which works in partnership with your calcium, they recommend 600 intentional units. So that's something that you want to make sure you have that works in partnership with the calcium. Vitamin D, milk obviously is supplemented. Vitamin D is what you get from sunshine as well. That's actually your biggest contribution to vitamin D in your body. So remember those two. Get your levels checked. Talk to your doctors about it. Make sure you get your blood work done on a regular basis. I wanted to move forward to exercise, which I know is something that you do on a regular basis. For osteoporosis itself, they say that it can decrease your fracture risk. When you reach menopause, and I'm jumping a little forward here because you're still in your 20s, when you reach menopause, apparently there's a 5 to 10% reduction in bone density. That's something that you need to consider. You also want to consider this with your exercise programs. Now, I know you work on the farm. I know you ride your horses. I know you walk your dogs. I know that you run the trails. You're big into running, jogging, all of those sorts of things, and that's actually phenomenal. You also want to consider some weight-bearing exercise, which I know that you do, but you want to make sure it's an intentional exercise. You want to make sure you're exercising. They say 30 minutes 3 times a week. I know that you do more than that, but on the weeks that you may have flare-ups or you feel a little bit fatigued or you just don't feel as great, you still want to intentionally make sure that you exercise 3 times a week for a minimum of 30 minutes. You need to remember, if you do have downtime on one of those bad weeks, your benefits of exercise are quickly lost. So you don't want to be down for more than a couple days. Again, you want to stay as active as you possibly can. Going forward into this, I believe it's going to be important for you to, and I know that you want to consider some alternative modalities. And again, always stay in touch with Dr. Eline, stay in touch with Dr. Manning. There are certain things called CAM therapies, and these are your alternative medications. Or I'm sorry, your alternative medications, so to speak. Your alternative modalities of improving your way of life, increasing your flexibility, maintaining your joint function, that sort of thing. There's some mind-body techniques that I know you've already delved into a bit, but the ones that I researched and are listed can also help with stress, which I know has come into play for you. They include hypnosis, guided imagery, meditation, yoga, which you're already doing, which is phenomenal. Tai Chi is something that you want to add in from a personal level. I do Tai Chi, and it's very fluid, it's very flexible, it's very much a mind-body game, so to speak. So you might want to incorporate that into what you're already doing. These techniques are based upon the interactions between your body and your mind and your emotions and your overall state of health. So I think that's something that you would be open to. and would certainly consider. There are suggestions that acupuncture can help. Acupuncture is these really, really thin needles, and they're placed in certain areas of the body to energize, so to speak. In some cases, they can relieve pain. It just kind of depends upon who you are, what you believe in, how your body reacts to this sort of thing. So, again, I don't know that I'm really telling you anything that you don't already know. I believe the intention is just to have you consider what's ahead, the various things that might help you, and just keep an open mind about what might work today, but it doesn't work on Wednesday, but it will work again on Sunday. And that goes with your exercise routine and your paraffin dips and that sort of thing, and meditation, all of that. I want you to be open. I want you to be open to anything that helps you improve your life, improves your mind, improves your body, sustains your joint functions. I do want to warn you, however, against herbal supplements. I know that a lot of people take them. They don't even have a second thought about taking them. And I always try and remind any patient this. If you're taking any supplements, if you're taking any herbal teas even, you always want to discuss these with your physicians. That's going to be important, that they're on top of what it is that you're doing, because you could have interactions with your medicines, and that's important for them to know. All of these things are important to you as a younger woman, as an active woman, as someone at the beginning of your rheumatoid arthritis journey. And I do say journey because this is a chronic issue, but this is something that can be managed. You are managing your signs and your symptoms. That's going to be vital to how you move forward. So when you view this video, I kind of want you, and again, this is very brief and overall, I kind of want you to maybe stop and pause every once in a while, look at alternative medications, your methotrexate, your prednisolones, consider where they might be in your game plan moving forward. Look at your alternative therapies, such as meditation and guided imagery. Look at your stress levels, see how they may benefit you at a particular time. Involve Cliff. This might be something that he would be more than happy to do with you, and he may gain some benefit also as a caregiver, as your spouse. So just continue to play this back, look at it, consider our original care plan, and just kind of work in partnership with all of it. You know, if you have any questions, always reach out to Dr. Manning, always reach out to Dr. Eli, and I do nothing but wish you well on your journey. Bye-bye. Thank you.